Thank you. I am very much privileged to have addressed in front of such a learned audience, headed by the head of the Department of Cardiac Surgery, Cardiovascular Surgery of DMCH, Professor Istaka Mendibu sir, and also the Assistant Professor Dr. Mohsen Reza sir, and the dynamic resident surgeon of vascular surgery, Manjurul Hassan, my dear colleague, staffs of DMCH, and the senior manager and head SM Shaukat Ali sir of Square Pharmaceuticals, and the staffs of pharmaceuticals. Good evening. Me, Dr. Kadia Husna Jamil, is going to present a journal which is day-to-day work of our in our cardiac surgery OT. That is the quantitative estimation of lima flow between extraluminal papaverine versus extraluminal papaverine plus interluminal vasodilator cocktail in CABC patients. The picture of the journal is missing here, sorry. The author of this journal is Vivek Pillai, Sri Kanthanan and Karunakaran, and it was published in Annals of Cardiac Anesthesia in 2020. The place of study was Department of Cardiothoracic Surgery, Sri Chitra Tirunal Institute of Medical Science and Technology, Trivandrum, Kerala, India. And it was an observational study. The objective of the study was a comparative quantitative estimation of differences in lima blood flow between limas treated with topical papaverine alone and limas treated with a combination of topical papaverine plus an interluminal cocktail of papaverine, nitroglycerin, and Miliron mixed with heparinase blood. Introduction: the lima has consolidated its place as the preferred conduit in CABC surgery, and the patents of lima is superior to the saphenous vein and other conduits. Nevertheless, perioperative spasm of arterial grafts is well documented and potentially life-threatening. Life-threatening complication when used as a conduit for CABG. Spasm in the lima reduces the size of the lima, thus making the construction of well-flowing anastomosis technically very difficult. Moreover, reduced lima flows in the immediate postoperative period predisposes to a higher incidence of chronic lima occlusion. The method: after lima harvested, lima pedicle was sprayed with 10 ml of diluted papaverine at room temperature and covered with a diluted papaverine sponge for 10 minutes, and the mean blood flow was stabilized to 80 to 90 mm mercury, and lima free flow was estimated by allowing the open distal end of the lima to freely bleed into a small bowl for 15 seconds, measuring the amount of collected blood, and the flow per minute was calculated accordingly. And a vasodilator solution was prepared by adding 2 drops of 1 mg per ml papaverine, 1 drop of 5 mg per ml nitroglycerin, and 1 ml of 1 mg per ml milrinone to 4 ml of normal saline, further diluted to a 10 ml with heparinase blood. From this solution, 5 ml of this vasodilator cocktail solution was administered interluminally to the lima in a slow retrograde manner through a distal end of lima over 30 seconds, so as to avoid hydrostatic distension with a soft tip cannula inserted just 1 centimeter distal end carefully, so as to avoid intimal injury. The distal end of the lima was kept temporarily occluded with a bulldog clamp for 10 minutes. Mean blood pressure again stabilized to 80 to 90 millimeter mercury, and after 10 minutes, lima flows were measured. The result is the observed lima flow when topical papaverine alone was applied to lima is almost 47 ml per minute, when intraluminal cocktail of papaverine, nitroglycerin, and milrinone was instituted into the lima, In addition to topical papaverine, the flow was 104 ml per minute, which is very, very significant statistically. Thus, there is a significant increase in the lima blood flow when vasodilator solution was instilled intraluminally into the lima. Conclusion, there was almost 100% increase in the lima blood flow when intraluminal cocktail was instilled in the lima along with topical application of papaverine. Than when papaverine alone was topically applied. Therefore, an intraluminal cocktail of milrinone, nitroglycerin and papaverine mixed with heparinase blood in addition to topical papaverine is a simple and effective method for lima preparation in CABC. There is several journals which also support these journals. It's an old journal, 2001, in the Wilson Medical Center, Israel, by Deep Zabida. They also studied intraluminal nitroglycerin causes vasodilatation of IMA, internal mammary artery, is a good vasodilator to be given when harvesting. Another journal which supports my journal that was led by Joe Wee and David Taggart, the great surgeon of UK. They found that overall in this world there is 5 common agents used topically or systemically for dilatation of the lima. Among them, the papaverine, nitroglycerin, sodium nitroprusside, alprinone, and calcium channel antagonist, etc. They concluded there is no perfect single vasodilator as the best vasodilator to prevent or treat spasm of arterial grafts. In view of absence of strongly convincing clinical data that one strategy is superior to another at present, we have given available options. One of the choices is to use combination of pharmacological vasodilators. So my home message is intraluminal use of vasodilators with extraluminal papaverine can increase the lima blood flow more than 100%. Then use topical extraluminal papaverine alone. And currently, intraluminal papaverine is used in Chicago Heart Center, Heart Institute, and milrinone intraluminally used in Mount Sinai Heart Hospital, USA. And intraluminal papaverine should be used mixed with heparinase blood, as it is acidic, so it can injure the endothelium. So thank you very much for the patience of hearing.